Well, there's been a lot of companies at this particular Congress saying that there's a lot of things they need to work on. And then there are other companies who believe they've been doing it right all along. I'm speaking now with Tami Graham, who's with Intel. And Tami, you're a Global Benefits Design Director. That's a mouthful. And it sounds like it has a lot of responsibility to kind of decide what's right for the Intel employees. Is that right?
Yeah, so my team is responsible for the strategic design of anything we provide an employee anywhere around the world that's not cash or stock. So any benefit program, we're the design sort of strategy arm. There's other parts of HR that deliver those benefits,
okay.
But my team is responsible for the design. So.
And health care benefits are certainly under that umbrella?
Obviously, and U.S. healthcare is a big amount of our spend. So
yes.
it is a big part of that umbrella.
But like I suggested earlier, a lot of the things that people are talking about, Intel already does.
We do, and so folks that are sort of worried about what health reform has done to them or what it might impede them from doing or change their plans. For us, many of the things that health reform required, we already did, whether it's preventive care or some of the other requirements. And the things that they enable, like wellness programs, again, we already have them. So it's great that other folks will be able to take advantage of those. But we feel like the reform law is really not an impediment. From a health IT perspective, as a company involved in IT, we think a lot of that piece of the reform law is actually very good for us. So.
And are employees very engaged in picking their plans at Intel? Do you find that they're a little bit more educated and motivated to search out the best options for them?
They are now. We've been on a journey since probably about 2005 that started with more traditional education and has moved really into more of a social sphere where employees are actually educating each other on our internal blog called Planet Blue. And when you first kind of get into that space, you worry about the kinds of conversations that may occur when you open it up to be that transparent. But employees are really the best advocates based on their experience. And we have people sort of changing plans and migrating to the plans that we think are the best plans because their peers are telling them that's a good thing to do.
Okay, well, that said, although you offer a lot of these great plans and options, not everybody is engaged, perhaps, in taking advantage of them. So what is the trick to engaging employees into taking advantage of the wellness part of it and some of the other things that are supposed to be good for them?
I think there's a number of tricks. There's not just one size. We don't all engage or learn the same way. So the social media is one avenue, and in some cases it's financial incentives to engage. We moved our participation in our wellness program from in the kind of 40% to 65% by taking what was a $50 sort of gift card incentive and moving that to the premium level and giving people $250 towards their healthcare premiums for engaging. And so, sometimes you have to put more incentives in, sometimes you use disincentives. It depends on what you're trying to get folks to do.
All right. And what is your advice to others who are embarking on this journey now and trying to get people more involved in advocating for themselves in terms of their health?
I think, for us, it's been a journey, and you try things and you have to be willing to fail and have things not work and learn from it and try again. Pilots are great, working with smaller populations and trying something and then, making it better. That's how we've done with our clinics. Our first on-site clinics we did in Arizona, and they were a pilot. And then as that engagement grew and we knew that we had the right model, then we began to deploy them in other sites. So pilots are a great way to try things out.
All right. Tami Graham, thank you so much for your time today.
Thank you.
I'm Abel Jung. Thanks for watching.